Hey, welcome to the Healthcare Nation podcast. I'm your host, Rick Janata, and we continue our series, this time with a focus on the consumer-centric aspects of the health sector. And we're going to be speaking with two folks from Uber Health, Swikriti Dasgupta and Lauren Brandon. I think we're going to have a fascinating conversation for you. But first, a quick disclaimer. The comments and views expressed are solely those of the hosts and guests. Please check out our website, healthcarenationpodcast.com. Follow us wherever you get your podcasts, particularly on Spotify and Apple. And don't forget to check out our YouTube channel. And with that, our friends from Uber Health. To continue our conversations on the big issues, this time focusing on something that's really been important to me, and that is the consumer-centric aspect of the health sector. So I'm really happy to have with us Swikriti Dasgupta and Lauren Brandon from Uber Health. Welcome, ladies.
Thanks for having us, Rick. We're so excited.
So why don't we start off by telling me a little bit about yourselves and what you do at Uber Health. And Swikriti, why don't we start with you?
Fantastic. Thank you so much for having us, Rick. Very excited to be here. So I'm Swikriti Dasgupta, and I recently graduated with a master's from Johns Hopkins University. And so as for my job, I was looking at two different things that I was super interested in. One was to have a global impact, and the other one that would allow me to look at a problem from the market access lens. And that was exactly what my role at Uber Health offered me, which is as a partnership coordinator. I am working currently in two divisions. So I'm working in the strategy and operations team, and then also the partnerships team. And I get to develop go-to-market strategies and also assist with launching new products, and also sort of see all of these issues from the vision of reimagining how people can access healthcare from a holistic lens. Very excited to be here.
Oh, fantastic. Really love that background, and especially the potential impact factor you have in that. And we're going to talk to you a little bit more about what those partnerships are going to look like. Lauren, how about yourself?
Yeah, thanks for having me, Rick. I have the pleasure of working with people like Swikriti who are super passionate about this space. I've been in health tech for the better part of the last decade and have a specific passion around non-clinical drivers of health. I'm a holistic health coach, and so have always had the foundational belief that our health is a sum of various factors that are clinical and non-clinical. I found my way into a health tech startup in Boston about 6 years ago, actually in the non-emergency medical transportation space. And from there, it was one of the first organizations that was really taking the NEMT benefit that was traditionally found in Medicaid and a little bit older and antiquated into the modern era through technology and partnerships with consumer organizations like Uber and Lyft. And so joined the Uber Health team about a year and a half ago on the partnerships team. And what that means is I work very closely with strategy and operations around developing go-to-market products, and then working with health plans and strategic partners to bring those products to market and have a bit of a business development function with some of that strategic operations lens. So really excited to chat with you today about what we're up to and what we're working on. And I've seen quite a bit in the NEMT space, if you will. So happy to talk a little bit about some of the positive changes we've seen over the past few years.
Fantastic. Well, let's dig right in on, I guess what I'd think about is crosswalking the transportation opportunity there. I think studies have cited that just missed appointments alone, I'm assuming hospitals and doctor visits are costing about $150 billion a year, which is incredible and impacting the lives of about 4 million Americans every day. And a lot of this has to do, obviously, with reliable transportation. It probably has to do with a lot more than that. But tell me, is this only about leveraging transportation? I think when most folks think about Uber Health, that's what they're going to focus in on. And certainly we could start there, but really interested in hearing your perspectives on that.
So transportation is a piece of the puzzle. As a whole, last mile logistics in healthcare are very disparate and managed very differently across organizations. A health system might be using taxi vouchers. A health plan might be using a non-emergency medical transportation broker, and a state might be working with a local transit authority. And so you have all of these different solutions from the transportation lens when really it's about access broadly, right? So do people know that they have a benefit available to them? Are they in a situation where they can advocate for themselves and find out if they're eligible for Medicaid benefits? Are they food insecure? And is there a way to meet members and patients where they are, not just from a transportation lens, but if they are food insecure, how can we, get resources to them or get them to the resources and enable them to sign up for WIC, SNAP, publicly available resources that might be available that they don't know about. Housing is another piece of this. If you don't have a roof over your head, it's very hard to understand what you even need to do to address your health. And I think understanding what you need to do to address your health is step one, and then having a way to get there is step two. So I think broadly it's about access. And so we believe there's a big opportunity to bring together last mile solutions that are technology and consumer focused and can really connect the dots across these disparate ecosystems. And so we'll talk a little bit more about that, but I would say it is more than transportation. It's about access broadly and just making sure that these last mile logistics are easy to operationalize and easy to access.
Yeah. Swikriti, anything to add to that?
No, I think she summed up beautifully, but we can go into more examples if that's helpful later.
Yeah, what I'm struck by, Lauren, in that answer is so much of it really has to do with the social determinants of health when you think about that across the board. And I think many of us, maybe the listeners, I will speak for myself, would say, wow, Uber Health, getting into that. But you said a key word, access, which I think of everything we've talked about in the podcast, starting back to Dr. Ram Raju, and we're looking at health equity and the access piece, to understand the role that Uber Health would play in that, and that last mile component is really, really compelling. Tell us more about that. And I'm really intrigued by the level of access and also the opportunity to let folks live independently in their communities. Is this part of it too?
Absolutely. Absolutely. We are extremely focused on, where the future of healthcare is going. And we believe that in the home and, virtual care and getting really creative about how you meet people where they are is a big piece of that. I would say fundamentally where Uber Health fits in is by creating more access options when it comes to transportation. So in the past, these transportation programs, like I mentioned, were run either through local cab companies or public transit authorities or local transportation providers. And so including the massive network that a TNC, so a transportation network coordinator, which is what Uber is, brings to the table is immediate scale. So right off the bat, you have a lot more as a part of a network. And then in addition to that, there are cost efficiencies associated with that, as well as the consumer choice piece of this, right? So as we think about what the population looks like, rideshare is not going to be the most appropriate option for 100% of members, but we found that it actually is a very good option for about 80% of people today. People that can get themselves in and out of a vehicle and people that can interface with technology. They don't need to have the Uber app to have a ride ordered on their behalf. And so where we've seen an immediate impact is working with these existing programs, which exist in Medicaid programs today, which is different state by state. And then the majority of Medicare Advantage plans do offer some sort of transportation benefit. So we're able to really extend the networks and maximize the opportunity for access within those programs from a transportation lens alone. And so we've seen success in programs just by quite simply working with Uber as a part of these programs on the transportation side. Now, there's a lot more that can be done beyond transportation. When we get into the idea that we can do deliveries, we can actually bring skilled workers and nurses into homes. There's a lot more that we can dive into there, but I would say foundationally on the transportation side, it's made a big difference. And then when you think about it from the provider side, having the ability to, log into the dashboard, which will tell you a little bit about what that looks like, and order a ride for someone and really have that trackability and traceability around that in a HIPAA compliant way versus just handing someone a cab voucher, it really reduces your risk of things like fraud, for example. Let's say you give someone a cab voucher when they're being discharged from the emergency room, which is a big use case, and they take that to the casino and go gambling and end up in the ER again 2 days later. So there's a level of transparency that's been added to the programs as well by having these digital solutions. And we have experience on both kind of the payer side of the house and the provider side of the house. So we've seen how it works on both lenses and have really made it our moat to connect the dots between those organizations for a better experience for everyone.
I also just wanted to add, since we are on the topic of transportation, and of course, Lauren has talked about how transportation is so beneficial, but also we have the ability to recently we have had an NEMT integration. So essentially we can provide higher levels of service too. And if by any chance, rideshare is not covering certain needs of members, then we can access the other population who would need a better or like more specific transportation.
Yeah.
And what Swikriti is referring to there is someone who cannot necessarily get themselves in and out of a vehicle. So someone who needs door-to-door assistance or let's say a wheelchair van.
Yeah, and I would think two things come out of that question to me. One is access, which is so absolutely important. And I think we really started on that, particularly when you think about underserved populations and just the lack of care because someone cannot get to an office. The other side is the care beyond the transportation side and connecting, but that you can facilitate, I guess, and enable. And I'm thinking about things like prescription drug delivery from pharmacies to homes. You mentioned meals. I'm thinking about other novel partnerships, taking caregivers there. And I heard that you're working on something with college-age kids, really, and also what you're doing to impact maternal health outcomes. Can you expand on those areas?
Absolutely, yeah. So the work with college-age kids is through our partnership with the organization PAPA. And so PAPA has a really interesting program in that it's essentially a caregiver benefit. So it's college-age children, or it doesn't have to be, but they're essentially trained and going to the homes of senior citizens and providing them with things like companionship, learning a little bit more about them. And with that, you may be to uncover specific needs that they have, right? Do they need a prescription picked up? Can we schedule a ride for them to do that? Can you recruit these college students on the flip side by providing them Uber rides to go to and from the home? One thing that we hear a bit, especially in urban settings, is when you're a nurse or any sort of skilled worker like that, going to 4 to 5 different homes and dealing with parking in a city is very challenging. And so these staffing organizations, when they think about the fact that you could offer Uber as a way to do this efficiently, it really opens up the door to more talent and more recruitment. And it ultimately leads to the scalability of these types of programs. So we're really excited about the partnership with PAPA. We think that it opens up the door to expanding upon a lot more beyond just the, very, very high touch aspect of it, where it's, there's someone who's interfacing with a patient or a member, can learn about their needs, and then can act upon those needs through this dashboard. And then what was the second question was on maternal health, right? Yeah. Maternal health is a project that's, really near and dear to our hearts at Uber. We've spent the last few years working on a study with the Sergo Foundation in partnership with federally qualified health centers in DC, where we essentially put together a program that proactively offered rides to moms in these underserved communities. And these moms theoretically did have access to Medicaid transportation benefits, but the issue that we found was that the benefit was not meeting the mom's needs specifically. I'll give you an example. Many of the moms qualified for just public transportation as a part of their benefit. And so you think about a mom who's 5-6 months pregnant, getting on the metro, trying to figure out how to get to the clinic for her visit. It's harder. And the no-show rates were really, really high in these clinics. And therefore the health outcomes very, very poor within these populations because they were not getting the prenatal care that they needed. And so we found that by having a coordinator who's working closely with the moms, following up and proactively making sure that they're aware of this benefit and that they can take an Uber, we saw an exponential increase in the amount of appointments that were attended. And we're still evaluating some of those clinical outcomes on the other side, but strong indicators that there's been better outcomes for mom and baby because of having this program in place. And so we really believe that being able to measure the impact of these programs just leads to more scalability, right? Because you go up to an FQHC and say, we think you should be paying for rides. They're going to say, no, there's already a Medicaid benefit and we don't have the dollars for that. So being able to show the ROI from a financial and a clinical perspective is really important to the work that we're doing. In addition to that, we believe we have the opportunity to help impact how some of the policies are structured. So like I mentioned, that Medicaid benefit was falling short for some of these moms. We have the data to work with states and other organizations and demonstrate that by having some wiggle room for moms that are within this population who seemingly should be able to take public transportation, but we see in the data that they are not, let's budget, $40 per visit for an Uber ride, and let's see the cost benefit analysis of that, and hopefully be able to create programs that meet them where they are.
Wow. Swikriti, anything to add to that?
I personally think that was one of the most strongest examples that was provided anyway. So I think she summed it up again.
Yeah. I can't help but think, Lauren, what you just described, you're breaking down the clinical outcomes, which is going to be able to compel and influence policy, which can actually become part of practice and new ways to manage populations, which is so important, particularly when I think you focus on something like maternal health outcomes, which the data suggests at the very least we could do much, much more for that population. And you're demonstrating that there is a way that Uber Health is doing it that is so absolutely novel. It's really inspiring. I would just stop there. Let me go on to something that you had mentioned, and I really wanted to explore, the Uber Health dashboard. And my first question is this beyond the beta test stage? Is it deployed? What's the background and what is on the dashboard? How do you leverage it?
So the Uber Health dashboard has been deployed. We are in partnership with almost 3,000 plus providers, payers, and clients in general. And then, so essentially it's a web-based dashboard and we can do API integration as well. So it's a B2B product. So you're essentially basically integrating with another client, and then the coordinator calls those rides for you on behalf of the riders. And so essentially the coordinator has the ability to communicate with the driver if needed, and also an automated message. If a phone number of the rider is provided, then an automated message or an automated call you can choose is sent right after the ride is requested. And so then the rider is fully informed where to meet the driver and then essentially where they can be picked up. And so the driver then meets the riders and then they drop them off where necessary.
So really,
and I'll add that.
Go ahead.
Sorry, go ahead, Rick.
No, I was going to say, it sounds like there's a lot of logistics in there, but I'm assuming there's room for scalability even with the dashboard itself. But go ahead, Lauren.
I was only going to add that the product is completely HIPAA secure. So that's a bit of a difference between the consumer app that people use today and then this coordinator-driven portal. So we do sign BAAs with all of our customers and make sure that patient information is protected.
That was really going to be my next question, is where do you go with respect to the security, privacy side? But having it HIPAA secure, I would imagine, would be a first principles side of approaching building out that platform.
That's right.
Let me ask you about the dashboard, because you had inferred that you're collecting lots of information and data on transportation and connecting patients to providers and the impact and influence that could have in the trajectory of their health. How do you acquire that information? Where does Uber Health collect that from? I'm assuming it comes from the dashboard when you look at the logistical piece, but how do you get the clinical outcomes component to that?
That's a very good question. We work directly with our clients to essentially make sure that we can evaluate that data at their discretion. So we would ensure that we have, the proper data sharing in place, or we would work with a third-party organization like we worked with Servo Ventures, who was able to work directly with Uber and then directly with the federally qualified health centers to evaluate the outcomes. So Uber's, a technology company. We do have brilliant people that work here and people like Swikriti who have, a whole lot by way of higher education and research behind them. But we oftentimes will leave that to the experts or to the care providers who are closer to the members.
Excellent. Let me ask you this with respect to Medicare, Medicaid, commercial insurance, where are you in that calculus? Are you seeing there's opportunities and folks embracing it? Is there recognition by CMS or by the big health plans, the Blues, Aetna, et cetera?
So the short answer is, I would say everyone is recognizing that access and social determinants of health broadly are a big need and they're making a big impact. So Medicare Advantage is one of the fastest growing spaces for supplemental benefits and really looking at the non-clinical benefits that can be offered. Those are offered by health plans really for two reasons. Number one, to address social determinants of health and, ultimately improve things like their quality overall, whether it's related to member experience, whether it's related to clinical outcomes that fall up into those stars ratings. And then the other piece of that is actually it's competitive. So Medicare Advantage plans are really looking for ways that they can innovate on these supplemental benefits that CMS, essentially made available if the plans are to file for them appropriately. This was started about 3-4 years ago. That plans started to offer these non-medical benefits much more broadly. And there's been huge adoption. I would say food is probably one of the benefits that's been adopted the most, followed by transportation not too far behind. And so a little over 50% of Medicare Advantage plans today, and we see even more of that going into 2024 planning, are offering transportation. And so when you think about that, Uber can service about 80% of Medicare Advantage members just based on the data that we have. And so Uber partners with non-emergency medical transportation brokers to be a piece of our network. And we maintain the direct relationships with the health plans as well, so that we can essentially expand upon what they're accessing Uber for. So they're using the non-emergency medical transportation broker so that they can address 100% of patient needs, as well as provide additional services like call centers, et cetera. And then there's the relationship where, we want to be working directly with the health plan as well to understand what the priorities are and what sort of products we should be building towards. So prescription delivery, I think that's coming up later on. That's another benefit that we're seeing Medicare Advantage plans start to file for. And so Uber's recently launched an RX delivery product, and we, want to be close to the plan to understand how should we structure this? How should we work with any existing benefit managers? I think one thing that you find with all these additional benefits is that there's solution fatigue. You have 5 different supplemental benefits that are non-medical and 6 or 7 different vendors. And so managing that operationally is very challenging and can oftentimes lead to really low adoption of the benefits just generally. And so our whole goal is to really understand how can we innovate on our product and our partnerships to make that a more streamlined experience. And so partnerships like with Papa help us to do that. Medicaid is a whole other story. because it is so different state by state. But we are definitely making an impact in the Medicaid space as well. Texas is a state that I would look to that recently started to allow for Uber and Lyft to be a part of their Medicaid program, and they've seen substantial improvements in how the programs run and just what the experience looks like for the members.
I am compelled to ask the question, has there been any conversation with hospitals or health systems, or I would say even, local, state and local governments, about having Uber provide not only the non-emergent, but even getting into the emergent transportation side of things, and start with ambulance, obviously acute care transportation, and even more than that?
Yeah. I would say Uber is more of an extension of those services. For example, health systems oftentimes will have to use their ambulances for a non-emergent ride. And so having Uber helps to open up those levels of service. We are not doing any emergency transport today. And, never say never, but as of right now, it's definitely not something that we're super focused on. We'll leave that one to the experts for now and help supplement the programs where we can.
I can't help but see that in your future, but that's my own prognostication. Let me ask you this. With these drivers, even if they're, let's just say, non-acute patients, you've got drivers in a situation where they may have someone who is under active clinical care. Is there any level of training or expertise that you require the drivers who are part of the Uber Health transportation logistics side to have?
So, go ahead, Swikriti.
Well, I was just going to say that the drivers, essentially, they are independent contractors. So we do not require certain level of training or expertise. But however, if there's certain things that would require a higher level of service by any chance, then maybe potentially a training, but not just to conduct an Uber Health ride.
Okay. Let me ask you.
And
go ahead.
Oh, sorry, go ahead.
However, sorry, Lauren, did you want to add something? Please go ahead.
Well, I was going to add that the main reason for that is because the power of Uber's network is in the scale. And so you significantly reduce that scale if it's only limited to trained drivers, et cetera. So that's not to say that we don't comply with background checks, specific regulations, et cetera. But we believe that the power of Uber is in the network. And so we don't want to limit that scope if we don't need to.
Another thing to add is that we do have additional coverage in place. So essentially, we work with organizations and partners to ensure that the drivers are in a safe environment and they know exactly what is expected of them.
Great. But not, this would not be accessible to the general public like Uber Comfort, Uber XL, et cetera, when you wouldn't be able to go in and you'd have to go through the dashboard. Is that correct?
Right. That's right.
Okay. Listen, we're getting towards the end of the show, and I try to end with something that's optimistic and also forward-thinking, and I would pose this to both of you. In my opinion, Uber really has a reputation for pushing the limits, and I'm saying that in a very positive way, clearly in their market where they're at. And now I'm assuming the same thing will apply in the health sector. So with that said, what is next with Uber Health?
Lauren, please feel free to add, but I can take a stab at it. But basically the whole idea, like Lauren summed it up so beautifully, is that we want to be an omnichannel marketplace for all things healthcare. So essentially we just launched, like Lauren said, the prescription delivery. We also have a potential of going into the groceries and OTC space. And we are already in the transportation industry. So we are at an exciting place where we can make massive impacts in a lot of different social determinants of health sectors. And we take a lot of pride in that, right? And so it's only like the potentials are endless, and it's only going to get more exciting as we try to push those boundaries, like you said, Rick.
Lauren, any last comments?
No, Swikriti said it perfectly. I think healthcare needs to go omni-channel, and we think we have a role to play in that. And, the best that we can do to bring familiar consumer experiences to healthcare, we're trying to do that. I mean, I think we've all interacted with the healthcare system and seen how frustrating it can be. And so if we can make it a little bit better for not only the patients, but for the operations teams that are putting all of this into motion, we think we have a really big role to play there with our technology and with our scale. So we're excited.
Well, on that note, Lauren and Swikriti, fascinating conversation. I will tell you, you've opened my eyes with respect to what Uber Health is doing today and where it's going tomorrow. I think the social determinants component, the impact factor there, to your comments earlier, really the potential seems to be, growing each and every day, particularly with, I think, the problems and challenges we have with access. So with that, ladies, thank you so much for joining us here on the Healthcare Nation podcast.
Thank you for having us, Rick.
Thank you. Great way to start the Monday.
Super.